Yes, I believe that these are three very interesting abstracts. The quality of the abstracts in GU non-prostate section this year was outstanding, and we struggled very hard to assign them in preferred and mini-oral sessions. So all three abstracts included patients with advanced or metastatic urothelial cancer treated in first line. So these patients never had any treatment for their metastatic disease. So all three studies are in line with the most recent progress in this field, which is the emergence of immunotherapy in first line. And more specifically, the combination of Enfortumab vedotin plus Pembrolizumab, which has produced very impressive results in first line and has become the standard for these patients. So in all studies, patients received Pembrolizumab plus something else, which in two cases was an antibody-drug conjugate. Now, it is important to remember that all the partners of Pembrolizumab were targeted therapies. One targeted FGFR, the other targeted Nectin, and in fact was the study which established EV-Pebro, but that was a retrospective analysis according to Nectin-4 expression. And finally, we have an old story with renewed interest, HER2 targeting, but this time with an antibody-drug conjugate. All three studies were very important. The study which investigated the role of Nectin-4 showed that Nectin-4 is not a selection biomarker in first-line metastatic urothelial cancer, but only for treatment with EV-Pebro. So it might be a useful marker, but for other treatments. FGFR targeting, I think it's the most advanced and most interesting and promising targeting strategy at the moment in this field. The results of an inhibitor of aberrated FGFR with Pembrolizumab were very promising, and certainly it's worth pursuing this issue further. Finally, HER2 targeting has not been successful in the past, but this time we are using an antibody-drug conjugate. Disitamab seems a very interesting agent and has produced encouraging results in pre-treated patients. And I would like to see this agent progressing, not only being developed, not only in first line, but also in subsequent lines of therapy, because we should remember that patients with metastatic urothelial cancer, in spite of the great progress, most of them will still progress and die from their disease.